Hair is a sign of beauty and youthfulness for women and a sign of masculinity and virility for men. That makes hair loss particularly painful for people, and hair loss can have a strong emotional impact on a person. Well, Bhringaraj improves hair growth, prevents hair loss, strengthens the hair follicle, and let's figure out why it does that. First, let's talk about why hair loss happens in the first place. What are some causes and what we can do about it. Then we'll get to the use of Bhringaraj as a hair tonic. It's normal to shed 50 to 100 hairs a day. That's okay because new hair grows in at the same time. It's just when that balance is interrupted that we get hair loss. Hair loss is also known as alopecia. And so, yeah, people see hair as a sign of good health or good genes. And Katie, who worked with me on this presentation, her Irish grandmother was bereft when after she made the decision to cut her waist length hair at around 14 years old. She couldn't understand why she made that decision and never let that go. So still talking about it 50 years later, right? Hair has significant ties to culture as well. You can see here different cultures in Africa. These cornrows were reserved for royalty, traditionally for the wives of the king. Here, you could see hairstyles have a religious component as well. The Sikhs allowing their hair to grow naturally. Muslims growing the beard after marriage. Jews with the tassels, the curls on the sides of the head, the sideburns. Rastafarians with the dreads. The hair industry is a big industry worth about $77 billion to help people feel youthful, beautiful, virile, or masculine, as the case may be. So how does hair growth happen, and how does it go awry? So here's a picture of a hair follicle, and you can see the blood supply at the root of the follicle, and then you see the hair being produced at the base of the follicle, and then there's a muscle attached to it, right? You ever get goosebumps? It's that muscle that gives you the goosebump. Then a sebaceous gland that secretes oils for the hair, and the like. All right, there are three phases of hair growth. There's the anagen, catagen, and telogen. Gen means to generate, right? And ana here refers to anabolic. So this is the anabolic or growing phase of the hair. That's 2 to 8 years. And in this growing phase of the hair follicle, this growing phase includes 85 to 90% of the hairs on your head. But for the hair on your arms or legs or eyelashes, they have about a 1-month growth phase. Catagen is the catabolic phase. This is a transition phase where the hair follicles shrink over 2 or 3 weeks. And then the telogen phase, which is the resting phase at the end where the hair falls out. It takes about 2 to 4 months to fall out. So an individual follicle may produce for 2 to 8 years, then go into the catabolic phase, and then the telogen phase, and then cycle back into the anagen phase. You can see that here. You can see that whole cycle right here. Anagen, catagen, telogen. See the hair getting thinner, and then it returns to anagen, and the old hair gets pushed out, and there's a new hair growing behind it. Okay, there's two types of hair loss, anagen effluvium and telogen effluvium. Effluvium just means shedding, right? We get all these fancy terms, but we don't really need them. This means shedding during the growth phase, anagen effluvium. And that happens when the hair follicle is killed due to some kind of poisoning or chemotherapy, that kind of thing. Telogen effluvium is when the hair follicles are pushed into the telogen phase earlier. What are some risk factors of hair loss from the Joyful Belly database? You can see here we've got stats of 10,000 people reporting hair loss, and we could check out some of those risk factors here, being older, underweight, cold, and with a sore liver. All right, yeah, so look, feeling underweight 20% more often, um, other aging signs, and large prostate. And large prostate is going to produce some hormones, DHT, that is going to end up causing hair loss. So you see a relationship between benign prostate hypertrophy with hair loss. And then as we look down here, we see sore liver, and then just other signs of aging: weakness, debility, ED, erectile dysfunction, and the like. Congestive heart failure, some circulatory issue too. You see here purple blue lips, brittle bones. All of that is related to signs of aging. All right, men are more likely than women to have hair loss, but let's talk about hair loss in women and then hair loss in men, and then we'll go over both together. Okay, 50% of women have notable hair loss. Here's a picture of hair thinning at the top of the head. You might notice lots of hair after you brush your hair or on the floor, in the shower, on pillows. You'll see noticeable patches of thinner or missing hair or a widening part. Seeing your scalp through your hair or thinner ponytails are all examples of hair loss. Why do you get hair loss? Well, first is harsh hairstyles and chemicals used in hairstyles. Here we see a very tight ponytail that's going to be pulling tightly on the hair follicle, and that can damage the hair follicle. So looks really cute while you have hair, but then afterwards, problematic. So styles that pull on the follicle are not good, as well as harsh chemicals, dyes, hair relaxers, etc. After pregnancy, it's common for your hair to fall. So hair thickens during pregnancy due to the increase in hormones. So pregnancy hair is known for being luxurious, thick hair. And then after delivery of the baby, estrogen levels drop, and that causes hair fall. That's common. And then hair falls again in perimenopause or menopausal stage when estrogen levels drop. Estrogen and progesterone drop. And then the ratio of androgens or male hormones, testosterone to estrogen, is increased. And all of that causes problems for hair. Follicles shrink, growth slows, hair grows back thinner, and etc. So with the increase in testosterone, you might notice new hair growing where there wasn't hair before, and that could mean on the chin or other areas. Androgenic alopecia, which is basically means testosteronic alopecia or testosteronic hair loss, is female pattern hair loss, and it's common in peri and postmenopause. And again, we're just going to mention chemotherapy. We mentioned that earlier. Female hair loss on Joyful Belly was associated with general female signs of aging, brittle bones, etc. Let's look at hair loss in men. You see here a very characteristic male pattern baldness. Starts with a receding hairline, and then a little patch in the back of the head that's missing hair. Both the receding hairline and the patch grow until it completely disappears, and you're left with just a little hair on the sides. Half the men in the world will experience hair loss by age 50. 70% will lose hair as they age. 25% see the first signs of hair loss at age 21. Male hair loss on the Joyful Belly stats was associated with more heat signs. And that was interesting. So look at for the overall database on hair signs, cold was prominent. Let's pull that up. Where was it here? So look at here. Lightness and coldness are the signs when we look at both genders. Well, typically in the Joyful Belly database, we have a lot of women and much fewer men. So when we filtered for men only, here we see for hair loss and balding and men, what the tables turned, and cold was below hot. But look at these numbers. Very, very negligible difference between the two. So 48.9, 45.8. Both of those were less than the average, right? So yeah, relatively not as cold. Um, but if but even the highest one is only at 56.9. Let's contrast this with for hair loss in both genders. Lightness and coldness was at the 80% level here, and dryness was also somewhat higher. And then for men, it just seemed that almost like there was no main pattern because all these numbers are pretty low. Right? Anyway, that's interesting that it's not really associated with as much cold. So I would say heat, but only by a small margin. Okay? All right. So let's look at the causes a little more carefully. First, the effect of hormones on hair. We're going to look at causes from a number of different factors. Effect of hormones, genetic factors, sebum production, liver issues, and then diet, lifestyle, environment, and medication causes. All right, so we're going to look at a number of different causes here. First, hormones. Estrogen. Estrogen aids hair growth by extending the anagen phase. Estrogen increases in pregnancy and you get the beautiful thick pregnancy hair, but it drops post-pregnancy and in menopause and with common hair fall. Progesterone inhibits the conversion of testosterone to DHT, and it's DHT that ends up interfering with the growth cycle and shrinking and shortening hair, making it easier to fall out. So what we want to do is prevent this conversion of testosterone to DHT, and progesterone does that. DHT is often high in those experiencing hair loss. Progesterone, by the way, increases in pregnancy, so part of the reason why you get the beautiful thick pregnancy hair. DHT is as an androgen male sex hormone. It's made from testosterone, and it's actually more powerful than testosterone. So testosterone gets converted to DHT by 5-alpha reductase, and it gets converted in the prostate, the testes, the number of tissues in the body, and this DHT is the sort of real powerful male sex hormone, and so the more that's converted into DHT, the more you see that shrinking or shortening of hair. So isn't that crazy? Men see hair as a sign of their virility, but it's actually increased testosterone that makes the hair fall out. So we should really flip that and see balding as a sign of virility. Testosterone only indirectly causes hair loss, only when converted. Okay. Genetic factors causing hair loss. Both genders inherit the tendency for hair to fall. And they can inherit either endocrine factors, they can inherit increased sensitivity to DHT, or just other genetic predispositions. There are 63 genes that may play a role in baldness, and only 6 are found in the X chromosome. The rest are on the Y chromosome. So that may be why we associate baldness with a male issue. And that begs the question, so does your hair come from your mom's dad, as the popular saying goes? Well, if most of them are on the Y chromosome, you probably get more of your hair traits from your dad, not your mom. Excess sebum production. Here's a hair under electron microscope, and you can see the oil that's produced by the sebum gland here is making the opening of the hair follicle pretty buttery. And then on this one, the oil's been washed away. Well, what happens if there's excess sebum production is that this whole pore gets clogged and the hair can't really come out, and that causes a problem. So, so we want to avoid overproduction of sebum, and sebum can be overproduced due to hormone imbalances, especially fluctuations during puberty and pregnancy. Also, due to a lot of heat, you can get more oil production, and genetic factors can play a role. All right, we talked about hormone and DHT and estrogen, some genetic factors, especially on the Y chromosome, some oil production, all causing hair loss. And then we also discussed how female hair loss was more associated with coldness and lightness, and male hair loss was more didn't really have any specific biocharacteristic associated with it, but both had signs of aging. Now let's take a look at liver issues as a cause of hair loss. Liver in general here is if the liver is impaired or there's liver disease, the main problem is that it's going to cause hormone dysregulation. The liver clears hormones from the blood. So hormone dysregulation fails to clear that the liver failing to clear those hormones can cause any of the issues that we mentioned, as excess sebum, other issues. If the liver is impaired, it can cause high immune sensitivity, and that can lead to autoimmune alopecia areata, which you see a picture of here. This is where there's patches. This is considered an autoimmune issue. All right, so we're going to look at the liver and just make sure the liver is doing well if we have a client with hair loss. Dietary contributors can also be an issue. Malnutrition, excess of vitamin A, or excess selenium can all have a factor. Crash diets, that kind of thing. Lifestyle factors, smoking or stress. Stress just pushes the hair follicles into telogen effluvium. Stress can also cause trichotillomania, which is the irresistible urge to pull your hair out. And I've known people with that condition. Alopecia areata, as I mentioned, was an autoimmune issue leading to patchy hair loss, and that can be aggravated by stress. Over-exercising, like malnutrition, can cause hair loss. Environmental factors, pollution can disrupt protein and make the hair fragile. Dust particles can trigger allergies or inflammation or scalp infections. Overexposure to the sun can cause split ends and dry hair out. Extreme heat can push hair follicles into the catagen or telogen phase, and hair falls out sooner. So you shouldn't take a super hot shower, get that super hot water on your head. Keep that hot water off of your head. In fact, I'm just going to even add that right there. Keep hot water off the head. All right. Medications and hair loss. Chemotherapy, as I mentioned. Some antibiotics, antidepressants, antilipidemics, things that are reducing your triglycerides, immunosuppressants, hormone replacement therapy, and vitamin A. Taking vitamin A can cause hair loss. So vitamin A is generally good for the hair, but taking too much of it can cause hair problems. Why do people take too much? Because they're taking acne medication, or they just eating too many leafy greens, or supplementing with vitamin A for some other reason. So overdoing vitamin A can cause hair loss also. All right. A few more notes on the development of hair loss. We've already discussed medication and environmental contributors to hair loss, such as pollution, dust, sun, and extreme heat. We've discussed some lifestyle factors like smoking, dietary factors like malnutrition, and excess selenium and vitamin A. We talked about liver dysregulation of hormones, too much oil in the hair follicle, or genetic factors and hormones like DHT causing hair loss. So, what does Ayurveda say? Ayurveda associates hair loss with loss of ojas and a vata pitta condition. Just generally, again, associated with aging, associated with cold, aging, stress, maybe liver issues, sebum production, and autoimmune. And notice we could split those factors into two. The vata covers the aging and deficiency. Pitta is going to cover excess oil, liver issues, and autoimmune. Treatment of hair loss. It really depends on the cause. You want to treat the root cause, so that's important. If there's a nutrient deficiency, supplementation may help. If it's just hormones fluctuating during teenage years, we might just ignore it. Vasodilation is the key strategy behind Rogaine, which is a popular medicine used for hair loss. And then anti-androgens, which block conversion of testosterone to DHT. So, but then the male will literally lose his virility, right? If you're blocking testosterone to get hair to prove your virility, that doesn't seem right. So you can do transplant surgery, you can do protein-rich plasma injections and microneedling. As you can see, people have put a lot of thought into trying to figure out how to keep your hair. What about just general herbal actions and strategy? Well, we want to reduce stress, dilate vessels, get lots of circulation to the hair follicle. Right? That's part of that Ayurveda pathogenesis with Vata, is that cold causes vasoconstriction, and that deprives the hair follicle of blood and nourishment, which robs the hair of color, strength, and may push it into the telogen phase. Remember, hair is associated with bone in Ayurveda. It's a byproduct of bone tissue. Okay, so a vasodilator is going to improve nutrient delivery to the head. We're going to look at hepatoprotectives, levotonics, and alteratives to make sure the blood chemistry is good. And then we're going to look at estrogenic and progesteronic herbs to strengthen and prolong the anagen phase of the hair cycle. And then your bone tonics. We can take a look at all these different foods to encourage hair growth. Feel free to pause the slide and check these out. I'm just going to go through them quickly. Biotin boosters, selenium, omega-3 fatty acids, keratin-rich foods, and vitamin B, C, and D. So I'd also put vitamin A in there. Again, don't overdo the selenium and vitamin A. Choose mild shampoos without harsh sulfates that will strip the sebum, unless you have an overproduction of sebum. But generally avoid daily shampooing. Stop smoking. Cover your hair when you're in the hot sun, and build up stress resilience. Great, we've talked about hair loss generally. We've talked about its emotional factors. We talked about some of the causes being hormones, genetics, sebum production, and exposure to chemicals, some medications that all can cause hair loss. Pollution, diet factors, etc., malnutrition, and stress. So now let's talk about Bhringaraj. Well, first of all, Bhringaraj has a particular affinity for the head and drives its herbal actions to that area. So Bhringaraj reputation is solid. It's one of its names is called Kesharaj, which means king of hair, and that's due to its ability to increase the rate of growth in the hair follicle. After 10 topical applications, 87% of test animals showed hair follicle growth, where previously the follicles were resting. Bhringaraj works by increasing follicle count and skin thickness as well, which has a sturdier foundation for the follicle. Bhringaraj aids growth of bone cells for a stronger skeletal system. As we know, hair is a byproduct of the bones in Ayurveda. Stronger bones equals stronger hair and nails. So Bhringaraj then becomes a very useful herb for U.S. practitioners because there's really only two FDA-approved drugs available for hair loss in the United States, and that's Propecia and Rogaine. Bhringaraj is often appearing in oils that you rub on the head. So Bhringaraj oil is a sesame oil that you rub on the head, and so you do a hair massage, and wait 30 minutes before washing it out, and then you could do it an hour before bath. The longer you leave it on, the better, and then rinse it off using cold water or just mild warm water. You'll see the benefits after about a month. You need some patience to get that hair growth. By the way, Bhringaraj oil is also rubbed on the feet before bed for sleep or stress resilience. But if you're rubbing on your feet and then going to bed, put some socks on so your sheets don't get dirty. Maha Bhringaraj oil is an oil that contains Bhringaraj and many other herbs. And it has a bunch of lung herbs in there. Can also be used as nasal drops, but it's also indicated for hair quality, split ends, and graying hair. So think about Maha Bhringaraj oil also. Here's some other hair loss herbs: ashwagandha, amalaki, punarnava, guduchi, hibiscus, gotu-kola, and turmeric. You don't have to memorize this list. I'm just mentioning it. Let's take a look at a formula for hair fall and high stress in menopausal Vata Pitta client. We have 3 parts Bhringaraj to strengthen the hair follicle and improve growth. Gotu-kola as a nervine, alterative, and hair tonic. Shatavari to nourish the hormones, to bring up those estrogen levels. Licorice root to moisten and rebuild fluids, counteracting dryness. And then passion flower to calm any anxiety related to that high stress. All right, let's talk about Bhringaraj and graying of hair.